Progesterone deficiency. So this is for women as well. So the main one for postmenopausal women is a hard time falling asleep. So estrogen helps women fall asleep. Sorry. Progesterone helps women fall asleep. Estrogen helps them stay asleep. And typically we know if it's one of those hormones, if it was significant after menopause. So somebody hit menopause and then all of a sudden they had a hard time falling asleep. We know that it's progesterone deficiency, or they hit menopause and they have a hard time staying asleep, and that's more estrogen deficiency. Then also depression and anxiety. Progesterone is known as the cuddle hormone. So it helps with mood issues. For premenopausal women, symptoms around your menses can include headaches and migraines. So, if you're, sometimes this happens as soon as somebody has their menses, has their period, or sometimes it happens around day 18, 19, 20. That's the point at which progesterone is at its highest. And if you don't have enough progesterone, it changes the ratio between the progesterone and estrogen, which is just below it. And then all of a sudden, progesterone, which is a major anti-inflammatory, all of a sudden, estrogen, which is a pro-inflammatory, all of a sudden you get inflammation. Okay, so that's very important to note in that last week, and those are premenstrual symptoms, that last week before your period. So that's why people also get depression, anxiety, fatigue, and other issues. So the laboratory tests to do, once again, the blood panel, the blood spot test, as well as the urine test. Once again, especially important if you're taking sex hormone replacement therapy. And then the laboratory data is significant if you see low progesterone on the blood test, the blood spot test, or the urine test. And here's the education. In my experience, it's very likely that someone has progesterone deficiency if they are premenopausal, so if they're still having their period, and they have one or more of the above symptoms, or if they're postmenopausal and have one or more of the above symptoms, including a hard time falling asleep. This can be corroborated by low progesterone levels in urine and blood, but is not necessary if symptoms are significant. And then reminder, urine testing is more accurate than blood. Once again, the conclusion, mark off whichever one is appropriate for you, and if it is a yes, mark it off on page 2 as well.